Hello, everybody. Happy Monday. So,
We're the trustees.
we are the trustees.
I'm Tony.
I'm Chris. This little lovely is Jasmine.
Sophie right here, the cutest.
And then M's over to the left. So hopefully you guys can hear us okay. So we wanted to hop on today to tell you a little story about little Miss Jasmine. So today she had to visit the vet. Actually, they both did. They got their rabies vaccination. But little Miss Jasmine, she's kind of our problem child. She has had bladder stones.
Surgically removed.
Yeah, in fact, I was going to bring it down because I actually still have the one that she had. It was probably about that big. And then she had several other bladder stones. We had that removed 5 years ago, I think. She has dry eye syndrome, so she gets drops every day. She has a thyroid issue, so she takes a pill every day. She stinks, smells horrible. So today, I thought maybe her thyroid was off, so we had it retested. And turns out her thyroid is actually really good. Nothing's changed. So I proceeded to tell him that about in June, I want to say, I came home, opened the door, asked her to come out. She jumped off the couch because they free roam in the house, and she jumped off the couch, came kind of to the top of the stairs, and she was kind of favoring her hind leg. So I'm like, okay, she jumped off. She stunned herself. She just moved on like it was no big deal. So kind of for the next 2 or 3 months, she's still kind of been favoring that foot a little bit. Not a lot. And she's our alpha. She bosses everybody. The big dog who's 118 pounds, Sophie, our cat, she's crazy. She is the alpha. If you say no, she's all over whoever said no, because that's not cool. And so she's still jumping off things. She'll run around the yard. She'll do whatever. So anyways, I brought it to the attention of Dr. Tyler today and said, hey, can you please look at it, because we think she hurt her paw or she's got a nail that's stuck in it or something. So he turns her over and starts feeling around, and he's like, okay. So then he has his little helper flip her on her side and starts kind of working all the way up to her hip. Then he says, turn her the other way. So she turns her the other way, and he puts her back upright, and he goes, she tore her ACL. I go, oh, okay. Yeah, she tore her ACL. Okay. I said, but she's not like whimpering. She's not doing any of that kind of stuff. And he said, some dogs are just better at masking their pain than others. And he said, I can't tell you if she's in pain or not, if it bothers her or not. It just kind of, it's torn. And he said she does use it because he can tell by the muscle buildup in her other leg. So then it's not a lot. Stop rolling your eyes.
I'm not rolling my eyes.
So anyway.
You're rambling.
So I got to tell the story.
It's the longest story ever.
So he said, we can fix it. I'm like, okay.
Let's let that down.
And he said, but it costs like $1,500.
Yeah, I don't think so.
He goes, if she was an athletic dog, or an athlete is what he said. If she was an athlete, then I would say for sure that you need to fix it. He said, but because she's a small house dog and she's obviously not in any discomfort, or she's not showing it, he goes, we don't need to do it. So we're just going to watch her and see what happens. We actually work for a great company that offers a product that we can use. It's a liquid collagen. And that will actually help, because he said she's going to get arthritis, and she'll get arthritis one way or another, whether we do the surgery or we don't. So that was more of his big concern, was the arthritis. So anyway,
what's the product you're going to use?
It's a collagen for dogs.
So it's basically like the trim for dogs kind of thing,
No,
or the
BioCell.
BioCell. The BioCell.
BioCell. Yep.
Okay.
Yep.
Cool.
My sister is currently using it on her boxer, and
If
he
you know
loves
anything
it.
about boxers, they're chronic problem dogs.
Yeah.
They always get cancer and everything else all the time, so they're a problem.
We're excited now to be able to use this on her and see how that works. So anti-inflammatory, it'll help rebuild that muscle. Collagen's great for your body, inside and out. Better than putting it on injections. So, anywho, and then today, so my title was 2 peas in a pod because I'm kind of a problem child myself. I had my labs done last Wednesday, and for those of you who do know, I have an autoimmune disorder. Basically what it is my body doesn't create neutrophil as fast as other people's bodies do. So what happens...
Other backstory is 2.5 years ago she had a lung abscess. And she didn't realize it. I didn't realize it at the time, but I did shortly after. She was this close to death.
Yeah.
She was hospitalized for a long period of time and everything else. She was not well. So she got very lucky in coming out of it. So she has the weirdest thing where her white blood cell count and her neutrophils are always low. That's natural for her, which is weird. So when she gets sick, it's a disaster.
Yeah.
So
if you guys don't know what neutrophil and all that means, this is how it was explained to me. So basically the neutrophil are like the neighborhood watch of your blood. And they roll around in your blood, and when they see something that isn't right, they alert your police, we'll call the white blood cells, and tell them that they need to go attack it and fix it. Okay, my body doesn't do that for some reason. I don't have enough neighborhood watch or enough policemen.
And anyone that has her numbers normally is very sick.
Yeah.
And she walks around like she's normal.
Yeah. I am.
So it's bizarre.
I am tired, but I've seen a hematologist, and
Yeah, no.
I've had a bone marrow biopsy. And
Most of them are shocked the way she is functioning.
Yeah. So we just watch it. So anyways, I went in for my annual blood test, and I was actually really excited. And I know this is kind of silly, but I was still low. I'm still low. I'm not even in the normal range, even close to the normal range, but I was higher than I was last year. So that was exciting. I called Tony, and I'm like, guess what? I'm better. Not where I should be, but I'm better than I was last year. So that's exciting. It's exciting for me. So anyway.
And there we go.
Okay. So the neighborhood dog's out, so we're gonna have
So
to
now
cut
we
this
must
short.
chase each other up and down the fence.
So anyways, we just wanted to share that with you today. Kind of funny news, but anyway, that's all we got.
Okay.
Is that all you got?
Yeah, I got to corral some animals.
All right. So see ya. Thanks for tuning in, guys.
Bye.
Bye.